Welcome to the second MPFT digital vodcast. Myself and Matt are here, joined by two experts from our community nursing field in MPFT. Before we start then our conversation, is it worth going around and doing a bit of a introduction? And I'll start with myself then. So I'm Steve Martin. I'm the Associate Chief Nurse for the Trust, but I'm also the Chief Nursing Information Officer. So if we go to yourself now, Matt.
Hi, so I'm Matt Tovey. I'm a consultant forensic psychiatrist and I'm the CCIO for the Trust.
Hi, I'm Suzy Keeling, the operational lead for the Rugeley and Great Haywood District Nursing Team, and I've been quite involved in the implementation of Total Mobile and the devisation of all the documentation that goes along with it.
I'm Rob Ratcliffe. I'm clinical lead for district nursing in Newcastle-under-Lyme. The same as Suzy, really, with me, we've worked with IT to sort out all the forms and assessment documents that need to go on to Total Mobile.
Brilliant, and thank you, Rob and Suzy, for joining us today. I guess the first question, Matt, of this podcast is, where do you think we're at now with the digital strategy in the Trust?
Well, we're several months on, and I suppose what we're trying to do is to get an understanding of how engaged our staff feel with this and how the strategy is going to come alive for them. And I suppose, if I can, Suzy and Rob, I'd like to ask you, what do you know about the digital strategy so far, and how do you think it aligns or links in with what you're doing? And perhaps, Suzy, if I come to you first.
Yeah. I mean, we've had the digital strategy round now for a few months, haven't we? And there is small videos to watch so people can, access it and understand it quickly, can't they, rather than reading the whole document. But it, greatly benefits service users, patients and staff alike, to help move healthcare forward, just to make everything easier, isn't it, Rob? And in that respect, yeah.
And if I can, you both mentioned kind of Total Mobile. For people watching this that don't know what that is, would you be able to explain it to them and perhaps some of the benefits that you're seeing?
So Total Mobile is basically an app that sits on a tablet that works in conjunction with Rio, which is obviously our clinical system. And it means that staff can access clinical notes and assessment documents when they're out and about on a tablet device. They then complete those assessment documents, and as long as they have some form of Wi-Fi, those assessment documents are fed back into Rio in real time.
Okay, and what if they don't have Wi-Fi where they are?
The moment they connect to Wi-Fi or go into a signal area, it will automatically feed back for them. They don't have to worry about it themselves at all.
Okay, so the information does sit there. So even if you don't have Wi-Fi, it sounds like you can do the work. Is that right?
Completely, yeah. We've had no issues with it whatsoever so far. When it comes to Wi-Fi connection, each tablet has got a 4G SIM card built into it, and which enables staff to work remotely. We can view lots of other professionals' documentation on the tablet device, so we can provide more seamless care and have a greater understanding of what is going on within that patient journey.
Okay, and what's the feedback so far from the staff and the patients?
The feedback from the staff has been really, really positive, and the fact that they actually like not having to carry around lots of paper documents with them that unfortunately can get lost. When you're writing carbonised paper, the carbon bit that you leave in the patient's notes can be very difficult to read for other people that are actually attending that patient's property. And so it's improved documentation in many ways. For patients, I would say a little apprehensive to start, but I think COVID has helped them because most patients now have actually got access to tablets, to laptops and other digital platforms, because obviously that's the way that they've kept in touch with their families throughout COVID. So they're quite used to staff now using tablet devices when they visit them. It also gives us the power to educate more when we're in the patient's home, because we can access certain videos and things from YouTube that the Trust has provided us with. So we can actually give a better education really to the patients when we actually undertake the visit.
I mean, that sounds really, really positive. I suppose I have to ask for balance. What have been the downsides to this, if any?
The downside, I would say, is it doesn't necessarily link to every mortal clinical system that we would require or would prefer to have. and it's very much a standalone, well, a sit to one side system, so it doesn't link in with any other system apart from Rio within the trust.
Okay. And Suzy, I know your service is about to go live. What's the feeling amongst staff with your service?
I mean, I think there's a big feeling of some, apprehension, but they're really excited about it because it's been a long time coming, really. We didn't expect it to be quite a year for us to do all the forms, but just because of other things that have happened in between. But on the whole, they're really excited about it. And only yesterday I had one of the staff members said a patient said to them, because they were writing on paper, and said, "Oh, I've run out of this." And then even a patient said, "But you're going to go digital soon, aren't you? You're going to have something in front of you to put it on." So even they're aware that this is happening, you know, and can see the benefits of it. I think from a point of view of in the south of the trust, we've had our tablets quite a while, and we have been accessing Total Mobile and doing certain elements of it, but we haven't done the documentation on it. So we've kind of had a bit of a phased implementation. So they're going to be used to using the system, accessing it. It's just going to be an additional having the documentation now and using that.
Lovely. And we heard from Rob, bit of a downside, perhaps it doesn't link with as many of the systems as we would like. But have your staff said anything that doesn't quite work as it might with Total Mobile, or that we ought to look at improving?
No one's reported anything back to me as yet, purely because we aren't using the system as it for documentation. Or perhaps the only one little bit they said is the way e-community that we use as an allocation tool and Rio can't talk to each other how we thought we'd like them to, just to reduce time of adding visits to Rio. But that's been worked around, and we're going to be able to use a Total Mobile device to actually put your patients on and search for patients and add them to your daily diary sheet.
Excellent.
There's been a workaround for that.
Great. And I know Steve's been looking at kind of the future of digital community nursing. He's chomping at the bit to ask a few questions.
I am, Matt. I can't keep quiet, can I? I guess there's a couple of questions for me on it, because you know it sounds hugely successful. You know, the rollout, the uptake, the patient satisfaction. I guess the first point from me would be, how have you done it? And I guess, how have you engaged? What I mean by that is, how have you engaged our staff in this? Because this has been rolled out at such a pressured time within the health nationally, and particularly within community nursing. You know, we've seen huge rises in community nursing referrals. You know, staffing has been under so much pressure, but you've been able to get the engagement and roll out a huge digital project. So can you tell me a bit of how you've engaged the staff in this? I'm really interested.
Yeah, from a point of view from how I see it is, we've been talking about it for a long time, going to digital documentation. But I think because COVID's happened and it's encouraged us to use, like Rob mentioned, use digital technology quicker, staff are taking on board that. And I haven't had any staff that don't want to do this, you know, and don't see the benefits of it, and I think they're just all embracing it and want it to happen quicker than what we've been able to do it as well. So no, there hasn't been any negative about moving to it at all.
I mean, that's really interesting, isn't it? So I guess the pandemic has accelerated lots of digital projects in the trust and wider, and this is one being, you know, this has obviously helped the lives of our staff by that. So that's really interesting. My other thinking was, you mentioned that service users, patients have positive experience of the system. I guess, how do we accommodate patients who perhaps aren't so digital competent or aren't so savvy with technology, shall I put it? What do we do? How do we upskill them?
I think that's always going to be very challenging because of the patient cohort that we currently care for in the community. I suppose it's very, very difficult. I mean, most patients will actually like to watch a video on the tablet. So as you're sort of like providing that level of education, if you can actually open a video and show it to them, you can be doing something else as while the patient's watching the video. And they're almost for those that really aren't into IT at all, they're almost dumbstruck at the fact that you can just press a few buttons and then bring something up that actually is meaningful for them. Yeah. But I think we will always, unfortunately, have patients that don't necessarily want to engage with digital, that would always prefer paper documentation left in their homes. However, the majority of care agencies now within the areas where I cover are also using digital. They don't leave lots of documentation. Patients do actually get worried as well if we can't find what we would probably class as the yellow folder. If they don't know where that's been put, it panics them because they think they're not going to get the care that they require because we can't find the folder, so we can't follow a plan of care. Whereas there's quite a lot of reassurance there now that because we have got a digital device, everything's in our hands and everything that we require is actually there.
Brilliant. I guess it's credit to yourselves, really, your services, that, you know, not just treating patients in the community, you're also educating them on digital as well. And perhaps we're forgetting that piece, you know, and that role. It's almost like digital promotion is part of our day-to-day working, you know, in our services now. So it's great to hear, Rob, that, you know, you're taking that time to show patients and service users videos, showing them how digital can enhance lives. So I think that is really positive feedback. I guess moving forward then, you know, thinking about the future of digitally enabled community health services, you know, this can only be the start of a journey, really. And you know, the end game, I guess, is how do we include everyone in people's care that needs to be involved, and what's next, really? What's next? How can we get to that point from a community nursing point of view? How can we get everyone involved? What do you see that are the next steps in that journey?
I mean, it's almost giving patients, service users and families the permission to access us by digital ways as well, because we have a few families that email us directly to our team email and we liaise that way with them. And it's quite alien to us as well to have emails from service users, isn't it? But it works really well for that person. And I think it's like Rob said, the cohort of patients we see is, you know, they aren't used and familiar to digital technology, but there's a lot on board, a lot of taking it on board, you know, and they've got family members who work with them as well because they're younger, especially grandchildren, isn't it, you know, and they can help them and things. So I think, you know, we're definitely moving in the right way. And it isn't just accessing us, is it? It's accessing other services as well, and information, and empowering patients to take on board, you know, their own care, and which is, yeah, it is very positive.
And I guess that links into sort of remote monitoring, does it? And if you had any experience of the remote monitoring devices and any feedback on them in the community?
Yeah, I've had some a while ago with an example was a diabetic patient, and we just wanted to know what their blood sugars were regularly, so they took them and used Flow, the technology Flow, to send us the results, and that worked really well. But again, you've got to choose your right patient to do that with, because you know, you've got to rely on them sending you the messages and everything in the first place, isn't it, Rob? I don't know if you've had any information.
We use Flow quite a lot still. It's more within our community matron services for that monitoring. But I think that there are issues sometimes with Flow. It's uncertain whether the message has been sent through and whether that's been actioned unless you actually call them back. I think anything digitally going forward, it can't be a one-way process. It has to be, we have to be giving patients that chance to sort of like communicate with us digitally as well.
Yeah.
Because I think digital can give a patient an awful lot of reassurance, especially if they got sort of like get an email with a delivery receipt or something else to say that has actually been delivered. It will be actioned at some point. But yeah, I think the way forward would be obviously to engage patients more and to see what we can develop to allow them to actually communicate with us via a digital route as well.
Well, that's really useful to know, and I think that feedback's really key, isn't it, in terms of the direction of travel. You know, that two-way communication is so important. I think that, you know, I think we've had a really good conversation there, Matt. Is there anything from your point of view?
Yeah, I guess I was just wondering, we've talked a bit about the staff finding the use of Total Mobile really effective, efficient. We've talked about where the patients are finding that useful and what we might do to support the patients in the future. And I just wonder, can you see a role for digital in any other way to support the staff more? So we're doing Total Mobile. Is there anything else that we could be doing to help them that might be via digital means?
I think one of the biggest things with staff at the moment is, because we've got so many different systems out there, they almost would want a system that's all joined up. So at the moment, we have to obviously use Rio to allocate, eCommunity to allocate the work. Then we have to input that into eCommunity, to Rio. Then that pulls through to the tablet. But then once we finish that visit, we still then need to go on to Easy to register our mileage. And if things started to join up more and actually flow better, then that would obviously encourage staff, because they would be saving their time. I think anything that saves staff's time is always going to be a big plus.
Robert, I think that's a really strong point, actually, and it's really well made, and it's something the Trust really does need to look at when we are looking for new systems. And we're in an age where you may have heard the term interoperability. That is a bit of the buzzword in digital. Systems should be talking to one another. What we absolutely don't want is digital to make life harder. That goes against all of the principles of this strategy. So thank you for that. And I suppose the same question to you, Suzy.
Yeah, it is exactly the same. I think because staff have said, like using eCommunity, and that can track you on a map to see where you are. Why can't that record their mileage of what they've done, so they don't have to input that separately on another system? So yeah, and it is just eCommunity and Rio just really talking to each other to prevent duplication of work, really. I mean, don't get me wrong, it's hugely better than what we used to use, which was paper copies or spreadsheets, wasn't it, Rob? So we really have advanced with that. We don't want to go backwards.
That's really good, but I guess what I'm hearing is, and I like this word, needs to be iterative, doesn't it? We need to learn each month that goes by, what could we do better? So when we do look to change things, we join it up and make it even better for our patients and our staff. So that's really helpful. Now, I guess Steve and I have said or asked the questions we wanted to know, but is there anything that you wanted to say or perhaps even ask of Steve and myself?
I think from my point of view, and it's not asking you two personally a question, it's just, I think we've had such support from both IT, as in senior IT people, and IT training. That has really helped with the implementation, and the fact that if we contact IT training, they will actually send somebody out for those staff that are quite sort of like digitally phobic, and they've actually spent time with those members of staff to ensure that they understand systems and the way that things work. So I suppose my question to you would be are there any more plans for other apps or systems within the community, digitally wise, currently?
And I'll probably let Steve take that one.
I guess, there's so many apps out there. There's recognised apps, there's apps which, our NHS Digital have signed off and approved apps. There's so much out there. It's really about what's the need, what's the service need. So if something's identified and it meets the needs of the service, but it also aligns with our digital strategy, we will 100% support that being implemented. So I think it's really down to the service and to decide on what the needs is, rather than us to say we're bringing this in, we're bringing that in. And I think that's at the essence of the strategy. So it's a bottom up as opposed to a top down approach that we want to try and instill in everything that we do, and that kind of links in with our continuous improvement methodology and that journey which I think we've described. We are on a journey. We know it's not perfect. We know there's going to be there's further improvements to be had on our digital journey, and it's about engaging with yourselves and your colleagues and your teams on what you need to make your working lives better. So there's lots of things is the answer. I could name a few. that I know that are going on, and a lot of it revolves around remote monitoring at the moment. There's lots of devices out there that we're looking at. There's lots of different ways of delivering care virtually, digitally. I guess it's dependent on yourselves and services to sort of say to us, look, we need this, we need that. Let's bring it to our digital assurance group. Let's get that buy-in. Let's get the project support. Let's get it implemented. So there's lots out there is the answer. And I'm not sure if that was the answer you were looking for, Matt or Rob. But there's a huge amount of work going on around that. But my message is to continue to engage, to continue to put ideas forward, and we can go out to anything that you need, really.
I think that's spot on, and yeah, I think the term that seems to be said quite a lot at the moment, which I completely agree with, is clinically informed, technologically delivered. So it's not what we think you need. It's about you saying, actually, this is the need that we have, and then us working together to go, is there a technological solution for that? And if there is, how are we going to make that work for you? It can't be, oh, well, we've seen this nice shiny app and we think it will work for you, you must have it. That's not going to work. So it has to be absolutely this level of engagement. And one of the reasons why we want to do the vodcasts like this, to get the message out there, to increase the engagement and let people know who we all are, so we can be approached to be as supportive as we can. As we've said before, the CCIO and CNIO roles are there to support. We're absolutely there to clinically support and lead some of these innovations.
And I guess from a nursing point of view, I always think of it as, we're aiming to get paper out of pockets. So anything that makes life easier, gets paper out of pockets, and we can digitalise, we'll definitely look at. But at the same time, we're not going to try and boil the ocean. We're going to do it step by step, and we're going to do that journey with you.
And I feel the clinical IT training team have been excellent, like Rob said, that they will come out and speak to you. All the videos, YouTube videos they've done, the guides they've done to using everything is really, really good and simple. And it's just spreading the word to staff to where to access that. And it is really easy to access once, you just know where it is on the intranet, but it really is good.
Excellent. Well, I suppose the final thing to say is thank you very much for joining us and talking about that. It's been really interesting.
Thanks, Rob.
Thank you.
Suzy.